Welcome to Dr. CM Edcast, your go-to resource for medical learning. Through discussions, case studies, tutorials, and debates, we help you learn, grow, serve.
Breathing. It's the first thing we do when we're born, the last thing we do when we die. We do it something like 20,000 times a day, and most of the time we don't give it a single thought. But have you ever really stopped to wonder what's actually happening down there? It's not magic, it's this beautiful piece of mechanical engineering. So today we're going to break down the physics and the anatomy of just one single quiet breath.
All right, so here's our game plan. First, we'll look at the fundamental problem our body has to solve to get air inside. Then we'll walk through the two acts of breathing in and breathing out. We'll get into the cool physics that makes it all happen, and finally, we'll see what happens when this perfect little system goes wrong.
So to really appreciate the genius of how we breathe, you first have to understand the core problem our body is up against every single second.
I mean, think about it. Air is stuff. It has mass. But your lungs don't have tiny little hands to reach out and pull air in. So how do they do it? Well, the secret isn't about pulling or pushing the air at all. It's about creating conditions where the air has no choice but to move all on its own. It all comes down to physics, specifically the physics of pressure.
Now, the fancy technical term for this whole process is pulmonary ventilation. But all that really means is moving air. It's a brilliant system that's not driven by force, but by creating and releasing tiny differences in pressure between the air outside your body and the air inside your lungs.
So how exactly does your body create that pressure difference? Well, it all starts by just making more room. And that brings us to Act 1, the muscular effort of expanding your chest.
For just a normal resting breath, what scientists call quiet inspiration, there are really two main muscle groups doing all the heavy lifting. You've got the diaphragm, and you've got the external intercostal muscles.
So the absolute star of the show is the diaphragm. It's that big dome-shaped muscle right at the base of your ribs. When you go to inhale, it contracts and flattens out, pulling downward. This one single action is responsible for making your chest cavity taller, from top to bottom.
At the very same time, these little muscles between your ribs, the external intercostals, they contract too. And what they do is pull your whole rib cage up and out. The source material uses this perfect analogy. It's like lifting the handle on a bucket. That motion makes your chest wider from side to side.
And that's not all. That same lifting action does one more thing. It pushes your breastbone, your sternum, forward, kind of like the motion of an old-fashioned water pump handle. So, in one single coordinated movement, your chest has gotten taller, wider, and deeper. The total volume inside has just increased.
Okay, so that's the crucial point, right? We've used muscles to make the space inside our chest bigger. But why does that make air rush in? Well, it all comes down to a fundamental law of physics.
This quote from our source really says it all. Gases, and the air we breathe is just a mix of gases, always flow from an area of higher pressure to an area of lower pressure. It's a law of nature. So by expanding the chest, we're about to create a little low-pressure zone inside our lungs, turning them into a vacuum that nature just has to fill.
Now, this graph is the key to the whole thing. It shows you what happens to lung volume and pressure over one single breath. And I want you to notice the relationship here. As the volume of air goes up when you breathe in, look what happens to the pressure inside the lungs. It drops. Let's dig into those pressure lines to see exactly how that works.
To really get what's going on, we gotta distinguish between two key pressures. First, there's the intrapulmonary pressure. That's just the air pressure deep inside the little air sacs of your lungs. Then there's the intrapleural pressure. That's the pressure in the super thin, fluid-filled space between the outside of your lungs and the inside of your chest wall. This pressure acts kind of like a seal, making sure the lungs get pulled open right along with the chest.
So let's put it all together. As the diaphragm and intercostals expand your chest, they pull the lungs open with them. This increase in volume causes the pressure inside the lungs, that intrapulmonary pressure, to fall just a little bit below the pressure of the air outside your body.
And you know what? It doesn't take much. A pressure drop of just 1 single millimeter of mercury, that's a tiny, tiny amount, is all it takes. That slight difference is enough to pull about half a liter of air rushing into your lungs during a normal, quiet breath. It's incredible. Okay, so the air is in. The oxygen has been delivered. Now, how do we get the waste, the carbon dioxide, out? Well, this is Act 2 of our little story, and for a quiet breath, it's remarkably effortless. So, unlike breathing in, breathing out quietly is a totally passive process. You don't have to do anything. No muscles need to contract. The diaphragm and intercostals that did all the work, they just relax. Your chest wall and your lungs, which are naturally elastic like a rubber band, just spring back to their smaller resting size. This squeezes the air inside, raises the pressure to just a bit above atmospheric pressure, and the air just gently flows out.
Now that's for a quiet breath. But if you need to breathe out forcefully, like when you're exercising or blowing out birthday candles, then expiration becomes an active process. You actually have to use your ab muscles and a whole different set of intercostal muscles to actively squeeze your chest and force that air out much faster.
This whole system of pressure changes and elastic tissues is so elegant, but it's also pretty delicate. So let's just briefly touch on what happens when these mechanics get compromised.
Take something like a pneumothorax, a collapsed lung. That happens when an injury lets air leak into that special intrapleural space, which breaks the pressure seal holding the lung open, and poof, it collapses. Or in a disease like emphysema, the lung tissue itself loses that natural springy elastic recoil. This makes exhaling incredibly difficult. Patients actually have to use their muscles to force the air out with every single breath.
So the next time you take a breath, maybe you'll actually notice it. That subtle lift of your ribs, the quiet descent of your diaphragm. It's this constant, silent dance of muscles and volume and pressure, a perfect little piece of engineering that's happening inside you right now. It really makes you wonder, what other incredible, invisible things is your body doing to keep you alive without you even knowing it?